Good afternoon, and thank you for joining us for today's webinar, Experiential Learning for Social Work Students, Building Empathy, Reflection, and Interpersonal Skills. Before we get started, I have just a few housekeeping items to run through. It will be recorded, and a copy along with the slides will be sent out to all registrants. Is it embedded throughout? Or is it not explicitly taught? Was it covered in undergraduate work? Or are you unsure and would need further explanation to explore further? I'm going to launch the poll now if you all want to let us know where how motivational interviewing is currently taught in your program. So it looks like we've got a pretty even split, about 24 people and a dedicated percent. 30% of people would need to explore further, so not quite sure how motivational interviewing is incorporated in the current program. So I'd like to now introduce today's presenters. With us today, we have Dawn Bornheimer, the Director of Healthcare Partnerships at Cognito. And also with us today is Brooke Handy, Key Account Manager for Healthcare at Cognito. And with that, I'd like to turn things over to Dawn to get us started today and overview the agenda.
Perfect. Thank you so much, Scott. And hopefully you guys can hear my audio okay. I know Scott was a little bit choppy, but hopefully you got the bulk of the introductions there. So today we're going to do a brief overview of Cognito, talk about the benefits of virtual humans, and then we're going to dive into motivational interviewing. We're going to review competency 6, and then Brooke is going to take over and we're going to do a demonstration and talk a little bit about implementation. One of the big goals of everything that we do at Cognito is to ensure that we make things as turnkey as possible for you. And as former educators ourselves, we know how important it is to have the facilitator guides, learner takeaways, anything that can allow you to create a holistic learning experience in addition to the simulation. So we want to make sure that you understand what you have and what's available to you when you partner with us. So at Cognito, we have a solid mission in reference to the power of virtual human interaction. So we have some of our virtual humans here on the screen for you, and we combine the science of learning and the art of conversation to use these virtual humans to improve social, emotional, and physical health. We do that through an interactive encounter experience, so a virtual human encounter experience in this environment. So today we're going to take a look at screening and brief intervention as it relates to adults, but we have different conversations that span across the lifespan. So we're going to talk a little bit about that today as well. So when we talk about virtual humans, in the simulated environment, the virtual human creates a unique experience for individuals. And we have done this work across healthcare, with government agencies, in the higher education space, as well as in the K-12 space. We've even got into that pre-K and early childhood space. And what we know for sure is that individuals really desire this opportunity to have a safe learning environment, not only where they can make mistakes, but where they can also learn skills, strategies, and frameworks like motivational interviewing that can really allow them to lead these real life conversations in a more thoughtful, fluid, and empathic way as they step into their profession. So thinking about the world of social work, you guys stretch across so many different career paths and so many different industries. You are able to support children and families in school systems, in the clinical space. And so we really want you to recognize that we've done this work in so many different areas, but today we're going to really zone in on the things that we know are most applicable to your career path. So when we look at the virtual human environment and we think about the power of the virtual human, we know for sure that these benefits exist in this environment, both because we measure it and also because we know that creating this virtual human environment creates a safe space. It reduces the likelihood of believing that the person sitting across from you is judging you in some way. So it gives you an opportunity to feel just a little bit less anxious in that learning environment. So increasing your engagement because you feel a little bit more open to the strategies and the skills that you're learning. Decreasing the transference that could occur in an in-person role play, and then the social evaluative threat, right? This idea that if Brooke and I were sitting across from one another, when I was in undergrad, for example, we had this room you would go in and there was the double-sided mirror, and you would sit in this environment and then you would know that everybody's watching from the other side of that mirror. But you would be a little bit anxious because you felt like your peer knew what you were supposed to say. In the virtual human environment, you're receiving unbiased coaching from a coach within the system, but based on how you're engaging with the simulation. And so this opportunity to feel less judged while practicing these skills allows you to build your confidence and self-efficacy to engage with these skills in real life encounters in the future. So relationship-centered conversation skills like motivational interviewing, which we're going to take a peek at. So with motivational interviewing, we often think about the 4 components of motivational interviewing. And so, Scott, if you could go to the next slide. I'm not sure if there's a delay here. When we think about motivational interviewing, this definition was actually in our blog, and we thought it was so meaningful and relatable that we decided to call it forward for you. And then the phases of motivational interviewing. So when we take about these 4 phases, engage, focus, evoke, and plan. I was talking to a client the other day about motivational interviewing and the necessity of moving through these stages one at a time in a way that your client feels seen and heard through each of these phases. And oftentimes we can acknowledge as individuals, we may start off with really strong engagement conversation, building rapport. We may spend more time on that front end so that the opening of the conversation feels really strong and we start to feel confident. And we're like, okay, they're with me, they're paying attention, they're excited about this appointment, I'm getting some good responses from them. And then we look at the time and we say, oh, I only have 10 more minutes. And we jump to the planning phase. And often the result of that is we haven't had time to listen. We haven't had time to understand their challenges. We haven't had time to help them to move through the change talk component of motivational interviewing. And in order to gauge their readiness for action, we really need to spend time in each of these phases. And so by doing an independent didactic component on motivational interviewing, for example, you'd have an opportunity to really hone in on these strategies, but then to practice them in an engaging environment gives you the chance to move through questions, move through affirmations, move through reflection and summary skills that really give you a chance to feel what it would be like to be in that encounter with someone as you move through these phases. And so when we take a look at the way motivational interviewing is taught at Cognito, we often refer to this wheel that Scott's going to show us. I know that the slides are a touch delayed, forgive my connection here. But we talk a little bit about the building of rapport and some of the other strategies I just mentioned. So the evidence-based strategies and techniques that are core component of motivational interviewing. So that building rapport, all relationship-centered type conversations, and giving you the opportunity to move through those will really hone in on the ones that feel most you feel most connected to. But we elicit responses. We get to hear their concerns. We reflect back to them what we're hearing. We ask permission in different phases to ensure that they understand where we're transitioning the conversation to. We try to be as clear as we can. Brene Brown often says clear is kind, right? And we want to make sure that we are being clear about the next phase of the conversation. And then we want to collaborate. We want them to become intrinsically motivated to be a part of their care plan. And then we continue to check for understanding along the way, making sure that they know that we're here to partner with them and to support them along the way. And I think it's always important to recognize that this is one of many meetings, one of many conversations that we're going to have with the client. And so we want to focus on what are the goals of this conversation so we can earn the right for the next conversation. And so at Cognito, we do offer a 12-minute motivational interviewing didactic. And sometimes that's just a great complementary resource. So for those of you that said, you know, we have a dedicated course for this, perhaps this would be a great addition for that. If you're thinking about where to embed it, or where you're thinking about how do we explicitly teach this. We've had a conversation recently with a master's level social work program that said, you know, sometimes we just expect that it was taught at the bachelor's level. And so here's a beautiful opportunity to just refresh everyone's knowledge around motivational interviewing. And so there's a couple of different ways to do that, but I think we feel pretty confident that it is embedded in all that we do, but sometimes that explicit teaching is really helpful. And so what we're going to take a look at is what we're hearing from our social work counterparts. So from the schools that reach out to Cognito and say that they're interested in our work and they would like to see how we align with the CSWE competencies, we often find ourselves in conversations around competency 6. So we've taken a few minutes to just highlight a couple of key things here about engaging with diverse clients, effective practice, relationship building and interpersonal skills. All of these things feel like the hallmark of Cognito. When Brooke and I are chatting about these things, we say oftentimes, you know, we can apply these skills to everyday conversations, everyday human interactions. And competency 6 is just that, talking about the engaging with individuals, families, and groups, and the organizations and communities. And how do you use these skills with empathy, reflective listening, and interpersonal skills so that we can see how they translate to the different work environments that you will be in when you step into your role as a social worker full-time. And so in the education space, we want to create opportunities to see ourselves in the learning so that we can translate that to our everyday best practices as we're meeting with clients across the country. And so we took a snapshot here of competency 6, but of course the full document is available at the bottom. There's a hyperlink here, and we certainly know if you go to CSWE, you would find that pretty easily. So the last thing that I want to review, and then I'm going to pass it over to Brooke, is we're going to take a look at some of the simulations that really speak to the social work folks that we talk to. So oftentimes we have quite a vast portfolio of therapeutic communications, but we hear a little bit more that some of these resonate a little more than others. So we decided to call forward some of the ones that feel most applicable. So we take a look at some mental health diagnoses. We have a conversation with adults as well as a conversation with adolescents. We know that it's really hard oftentimes to get field experience time with adolescent patients and clients. And so we just really, we think it's important to always acknowledge where we have conversations with adults as well as with adolescents. When you look at substance use, screening and brief intervention specifically, we do that with adult clients, we have that with adolescent clients, and then we also have one specifically focused on opioid use disorder. And then co-occurring, this is the second of 2 in a series that we developed with NORC out of the University of Chicago. And that simulation is designed to present both mental health and substance use concerns, and how do you prioritize when both are present. And then we have an in-home visit that also gives a snapshot of having a conversation with a parent that has a young child in the home. And so we hope that some of these be interesting for you. We're more than happy to share them along the way. But today, Brooke is going to take a look at the screening and brief intervention that we have available specifically for adults and the complementary resources. So I'm going to go ahead and pass it off to Brooke now.
Thanks so much. Dawn, can you hear me? Perfect. So we thought what we'd spend the next few minutes on is showing you those practice opportunities, right? So the motivational interviewing techniques that you are imparting to your students through your program, the ones that they're learning through your course materials, the information that they're gaining from our didactic, what does that look like to put that into practice with the simulation? And then also share some implementation tips that we have developed and also that we're hearing from the field. So Scott, thank you very much. So we're going to start with this first slide because as we're presenting the actual simulation, we sometimes have faculty kind of stop us and say, okay, how are folks using these? Is this to be used with the whole group? Is it in my lecture? Am I doing it independently? And the answer to all of that is yes. We think that when you see the simulation, you'll see that the true value is that independent practice. But where you place that independent practice is really up to you. And we've done a lot of work in creating some facilitator resources that I'll show you in just a few minutes that will help support you in deciding which way you want to deliver this. So if you look at the bottom part of the screen, the self-directed opportunity, this is certainly, as Dawn mentioned, they're turnkey. Your learners you can give them a little background knowledge, turn them over to do the complete simulation, and then just do a post-simulation summary in your lecture. You can certainly use them as lightly as that. But what we heard in 2020 is that folks were looking for a couple more supports for faculty or facilitators. And they'd also like to have some opportunities to really stretch out that simulation, to have more curricular time dedicated, using the simulation as a cornerstone and a piece to guide the instruction before and after the students practice that simulation. So we wanted to start with this to build a little background knowledge. So as you watch the simulation, you can kind of get an idea of how it might be used. So Scott, that next slide, please. So we're going to dive in now to the simulation that we're going to be looking at today. So as Dawn mentioned, we have several simulations that speak to social work programs. Today we're going to look at SBI for adults. And the goal of the simulation is that learners are going to practice using those MI techniques and communication skills with 3 adult clients. We're going to look at Mark today. So if you kind of look at his scenario, Mark is a veteran. He's coming diagnosed with some pre-diabetes, and he's also reporting some risky alcohol use. So students get that background information. It is a telehealth encounter. So we're going to look at some best practices for using these techniques in a telehealth world that we're living in now. But also, if you'll call your eyes over to the little box over here, you'll see where it says simulation 70 minutes. That's the approximate time that students would spend in the simulation itself. But in some of our catalogs and some of our marketing material, you'll see now we have added curriculum hours. And what that refers to is that top part of that previous slide. If you stretch it out and you use some of the support materials that we have, and you embed the simulation and some of the support materials into your lecture, you can really stretch this out to 5 hours, closer to 5 hours of virtual experiences. And one other detail I'll give you on the slide here, we are working to make sure that our simulations, because they are also used for practicing clinicians, that they have those CE credits as well. So I was just on a previous call and learned that this has also been credentialed for 1 credit of NASW. So not sure that that is important to your undergrad students, but if you have MSW students that are working in the field and that is important to them, just know that we hear you when you say that those credits are important for practice. Lastly, those learner goals, you can see that there. We're going to work, again, this focus is on the screening and brief intervention practice with these 3 clients. So Scott, if you can continue to that next screen there, and I think we'll be able to dive right in and get a look at Mark.
So this is the menu that your students will see once they unlock the enrollment key that we share with you upon implementation. And you'll see that students have everything that they need right in this menu. They also are able to complete the simulation on any device that they have, and it lives within our server, which is usually good news for your IT department. So before we dive into some information and the conversation with Mark, just some background on what students will be able to access. They first start with the objective of the simulation itself, which we saw on the previous screen, so that if you decide that you want to turn this over with very little setup, they're able to do that and understand what they need to do to complete. They're also given at the beginning of the simulation, anything that has this play button and that's under our learn topic is the didactic on the content related to the simulation. So we do suggest that students complete this section before they move into the practice opportunity. And certainly you can turn this over and have them complete this on their own. Or we've been hearing from some faculty that they like to use this didactic because it may be information that builds into a lecture within the course itself. So if you're doing a deeper dive into screening tools that students are seeing used in field experience or what they might see in their interventions, this is a great way to bookmark or backpack the activity with the didactic here as well. So again, the didactics are related to the content of the simulation. You can see here we have a screening, brief intervention, and because this is a telehealth encounter, there are some best practices related to using MI techniques in a telehealth world. So with that, we're going to jump right into Mark. We've learned a little bit back about him from our previous slide. You'll also see here that there are other conversations, much like we suggest that you complete or students complete the didactic first. We do suggest that students complete the simulations as they're laid out because they are scaffolded. So there may be a little more support in Mark than there would be in Jessica, who's later on in the simulation. So just a little feedback there. We're going to start over here.
Hi, Mark. I'm Gabby.
Hi.
I work with Dr. Singh, and part of what I do here is to help people talk about a new diagnosis and what that means for them.
Oh, okay.
Dr. Singh told me about your pre-diabetes diagnosis. How you doing?
fine, as well as I can be.
So if you have not seen our simulations before, your learners are participating as the clinician, and in this simulation, that's Gabby. We work really hard to make the clinician be agnostic in case you wanted to use this in an interprofessional education opportunity, which we know an interdisciplinary care team, a social worker is an important member of that. And so if you wanted to use experiences across your nursing program or your counseling program or School of Medicine, these are able to be done in that way as well. So playing Gabby, the goal is to, again, work with Mark to build rapport and get him involved in a care plan. So the magic really happens under the talk feature. This is where students are going to apply those motivational interviewing techniques that they've learned from you, from your courses, and from the didactic. So they get choice here. They can build rapport with Mark. They can choose to offer an affirmation, or they can dive directly into discussing drinking, the questionnaire that he filled out. So the screening has already been done for Mark. As a student, I'm going to think back about my prior knowledge and what I already know, and I know how important building rapport is. So I'm going to make the selection to build rapport. So I'm going to choose this one to start with his diagnosis.
What do you think about the prediabetes diagnosis?
Apparently, I can't eat anything now. Figures.
Life can be hard enough, I know. And now this adds a whole new set of things to think about.
Yeah, add it to the list.
So using that choice, it did start to build rapport. We saw it was kind of a little bit of a pain point for Mark. So thinking of that, we saw modeling by Gabby to lead with empathy, to understand, to hear him, what he's thinking, and we can decide what we want to do next using the talk menu. So our choices changed just slightly based on what we chose last. So we have less options for building rapport. We can also do the same options that you saw previously in affirmation or discussing drinking. I'm going to choose one more, build rapport, because I don't know that I got as far as I'd like to in building that trust with Mark. So I'm going to choose this one that inquires about his military service.
You said you served in the military.
Yeah.
What branch?
The Marine Corps.
Nice. I hear Marines have the toughest boot camp. A lot of people don't make it, right?
Yeah, people don't know what they're getting into.
So after we finish that part, if you'll train your eyes here, you'll see we're getting some feedback from a coach. The coach is someone they likely have met in the didactic pieces at the front end of the simulation, but this is someone who is going to give them objective feedback along the way. So let's see what our coach said to us based on that last choice. So she's praising us that we chose a good choice, that showing interest in someone that has military service can help break the ice and help build that rapport. So again, that unbiased coaching is built in along the way, helping the student self-reflect. Let's do a few more. Again, our talk features change a little bit based on what we said last. Some of the same options here, but you know, I'm a student, I'm going to dive right in. Let's look what happens if we dive in and we start the conversation on what the intervention might be. So we know that Mark filled out a questionnaire, and we know that an open-ended question is a good way to go. Let's try that one.
Today you filled out a questionnaire about your drinking habits. Do you mind if we go over some of your answers?
Maybe. Something wrong with my answers?
Not at all. This is something we try to do with all of our patients. When you get a new diagnosis, it could be an important time to think about how different habits fit into the big picture.
I guess.
So choosing that kind of gives us a full stop from our coach, reminding us that as far as cultural competency, sometimes military patients and clients have reasons to be cautious. So thinking about that and understanding that might help us decide what we do next. It also shares that he might benefit from us sharing exactly why we're asking that information. So that feedback is important. You also, throughout the simulations, will get some introspection into the client, which is great for student learning. So let's hear what Mark had to think about that last conversation piece.
Should I be talking about this? Is it going to come back to bite me?
So again, that introspection, what someone else might be thinking versus what internally I might have thought in that situation, is helpful for student learning. Also, this is a good time to point out the undo button. We have students, even from our student surveys, say that they appreciate the ability to undo. Not so much from the fact of getting the right choice, but they saw several choices within the talk menu that felt right, because there's so many pathways that motivational interviewing techniques can lead us down. So it's really the engaged learner that often uses that undo button and explores a little longer than the simulation might allow for. So one more, and we'll move on. So let's look at our options now. So we have share information, again, getting information, or we can discuss confidentiality. I'm going to think about what I learned from my coach and how that last experience went, to think about that piece about building some confidence with Mark to let him know what I'm going to do with the information. So for me, discussing confidentiality feels like a good choice.
I know you might be used to your medical history getting reported to command.
Yeah.
Right. Things are a little different now. I might take some notes on our conversation in case we need to follow up with your next visit, but unless you or someone else is in danger, threats of violence, child abuse, stuff like that, federal law means I can't share medical information with anyone.
Not even my boss, or in a court case or something?
A court could order us to release some information, but that's pretty rare. If you want to read up on this, it's all in the HIPAA statement you signed.
Okay, I get you.
Got a little more feedback from our coach. And again, some praise there, letting him know that the information is confidential could ease his mind. Just to show you how this starts to funnel our activities, we're not going to go any further, but you can see the choices start to become a little more funneled, guiding us to the brief intervention strategy that we're using with Mark. And that's how students will proceed through the simulation. I'm going to move over to the menu. Dawn and I are happy to share any of the simulations within our portfolio with you so that you can experience this firsthand when you have time available. Let's see if we can get to our menu here. So a couple more things. Again, that's the true value. That's the application that the students are practicing those motivational interviewing techniques in a safe environment to build that confidence when they get in front of actual clients in their field experience and when they practice after graduation. As we scroll down, you see other practice opportunities with Sam and Jessica, which we've talked about. Students also get, let's scroll back up for just a moment, you'll also see when the student completes the simulation, there's usually, in most simulations, there's a performance dashboard. So students are going to get some feedback. All the coach notes and things like that are going to come into some data that students can use for self-reflection. So how well did I do in the brief negotiated interviewing process with Mark? What might I need to work on? Did I move too quickly towards that intervention piece? Things that students can use if you assigned a self-reflection activity, for example. So those are all found performance dashboards on each of the client conversations. And where I'd like to explore just a few minutes is in the supplemental materials and resources. So as I mentioned, everything for the student is here, but we also have materials for you, the faculty or facilitator, here. If you'll recall earlier in the presentation, we mentioned that you could absolutely turn this over to students and let them do the simulation on their own with just a little bit of post-simulation debriefing. However, again, what we're hearing is faculty and students are appreciating the ability to stretch this out, to be able to use it a little more frequently within their classroom. So the course materials that we have created for all of our simulations help support that effort. One of the first resources that I want to share with you today is the learner takeaways. So learner takeaways are a great way to build background knowledge for not only students, but faculty that might need a brush up or some consistent language on what is motivational interviewing, what are the techniques used. I know we asked earlier in the presentation here about how much you're using that within your curriculum. This is a great way to add that consistency piece when it comes to motivational interviewing. So again, kind of a cliff notes, if you will, of the motivational interviewing strategies that are found within the simulation that they're practicing. We also suggest that students review this before they complete the simulation, because again, it gives them background knowledge to hook that new information on. You certainly could assign this light reading and offer a discussion board question. Perhaps it's an entrance ticket to get into the classroom for the next stage of lecture, but lots of ways to use the learner takeaways, but a great document to give consistent knowledge. Again, that's the learner takeaways. The more robust document that we worked very hard on are the facilitator guides. And the facilitator guides allow you to really get all of the information that you might need to implement the simulation with success. So I just want to highlight the menu here. You can see this first front-ended information in blue is all the information that helps faculty be able to get a read on the simulation itself. There's learner goals here. There's information about the dashboard. It actually almost shows a rubric of how that scoring works. So lots of information here that can help guide your decisions. We have faculty share with us that this information, this front end, helps them not only decide perhaps what program they might put the simulation in between undergrad or graduate, but it even may help guide which course, and then even further, where in the syllabus might you put the simulation. So lots of information here in the overview of the simulation itself. The large green section in the middle, that in that slide that we showed you a few slides back, where you could do a workshop kind of experience, this is the entire set of activities that can be used to really flesh it out. So if you're looking to extend to close to that 5 hours that we mentioned in the curriculum hours, these are some of the resources that you can use. We also at the end have some role play scenarios that we also suggest that you could do in the workshop that are additional ways to practice the content that is also delivered within the simulation. Dawn and I are happy to share this in our follow-up with you because we do feel like it's a great front-ended resource to envision how you might implement the simulation. And we're going to journey back just one moment here. So those are the learner takeaways in the facilitator guide. And then if you look towards the bottom of the additional resources, lots of great nationally recognized resources here. So more information on screening tools. There is a resource on telehealth best practices found here as well. So lots of resources for your students and you to use in the classroom as well. So we're going to head back to the menu here. And Scott, I'm going to take it back to you to get to those last two slides.
We wanted to just take a few minutes, just some last little notes about some notes from the field, what we're hearing from other social work faculty. Many during COVID felt that these are great experiences for remote-based field activities to supplement during COVID, but they're also finding, and that next bullet kind of speaks to this, that sometimes students aren't given opportunities during field practice to be the well-rounded graduates that they're really wanting. So they feel like the clinical practice scenarios give those opportunities. We're also hearing from folks that they are assigning a reflective assignment or a journaling activity to highlight that self-awareness piece, how might their background and their information guide the conversation pathways they choose, how they interact with clients. And then lastly, we have they might have the students experience the simulation the first time for the engagement piece, but maybe visit again with the goal to practice documentation and use the case as the content for a case note. So with that, I think we're going to I know we are a little over here, and I greatly apologize. We do want to share with you that, and you can pop it in the chat today, or you can reach out to us afterwards. We are actively listening to what social work programs need. We heard that in 2020. We are our ear to the ground to make sure that we are providing simulations that speak to what your student learning outcomes are. So as you are reflecting on the end of the year and you're thinking about what would serve your students in your program well, if you can connect with Dawn or I to share those information, if you want to reach out to your colleagues first, again, we are listening and we are grateful for all you do to support our community.
Thank you guys so much for joining us today.